The other agenda item for legislators during this special session is deciding how to spend more than $1 billion in federal COVID relief funding. A lot of areas and projects that need some financial help. In your eyes, Senator Feldman, what should the priority be for lawmakers with this kind of money?
Well, they were asked to do an awful lot in a very short period of time. So I think that's what they're struggling with. What is the priority here? Is it actually a crisis, addressing crises,
Right.
or is it producing something that's rather transformational and long overlooked? And so, they have, I think, opted for some crisis to crisis things, some infrastructure things, broadband, roads. But I think I, for one, am very disappointed that they did not focus more on public health and prevention rather than building a new hospital. There is in this budget here funds for a hospital in Valencia County. And we need hospitals. Don't get me wrong. I hear Merritt when she talks about Gila Regional and how strapped they are. But, a hospital is different than having a program and a plan to address the chronic diseases, the disparities that have made the pandemic so much worse in New Mexico than it should have been based on our population. And so that's one of my regrets.
Right. Laura, bringing these two stories together, part of the debate in the Roundhouse over spending of this COVID relief dollars centers around a potential new hospital that Dee Dee mentioned in Valencia County. It passed by a 65-1 vote. Interesting point there. Supporters say it's long overdue. Detractors say there aren't enough people. It's about 100,000 in the county, if I'm not mistaken. Is this a worthy effort for the money, $50 million?
So it's hard for me to say that whether that's worthy of 50 million. I mean, I think that's probably on par with the cost of other similar facilities. But, I'm a big proponent of making sure that you match sort of the source of your funding and the duration of your funding with your expenditures, right? So you don't want to use short-term funding for a long-term effort that you're going to have to figure out how to fund continuously. And these are short-term dollars. And so, it's really important. I think Senator Feldman hit the nail on the head when she said that she's disappointed. And I think we all shook our heads, yes, when she said this, disappointed about the lack of funding for healthcare. There is so much need out there right now. A facility is important, yes, but that's probably something that you should put into the regular course of funding as you go, right? Because you're going to have continuous need. There's an educational component to that. You need to make sure it's staffed. You have to be able to have, there's just a whole lot of things that are necessary, but you also need a lot of short-term spending to make sure we get this pandemic under control. And that should have been dispersed, I think, across other parts of the state. And so that's one area that they could definitely have prioritized a little bit better. I do think that there probably was some pressure to get something done in terms of the economy and getting people back to work. So infrastructure is always sort of an opportunity for that, because you do end up spending short-term dollars, or in the short term, you're spending money, and there's construction jobs. And so there's a bump to the economy that way. But I just think that there should have been more discussion about how to address the current crisis that we're still in. There's too many people who think that we're sort of out of the clear, and I don't think we are.
Well said there. And Merritt, to follow up on that, as of Wednesday's update from the health department, 666 people are hospitalized with COVID-19. Significant spike over the last month and a half here. And now the state reported its first case of the highly transmissible Omicron variant that's here now. Is this going to make people rethink their holiday plans, or just how we do our regular thing? What's the upshot here in your view?
Well, I'm certainly concerned about that. And I think agreeing with both my fellow panelists, public health has to be a concern. And I think our schools, greater measures in our schools. I've been kind of shocked to learn, I have two close relatives who work in public schools. We do not have significant or sufficient daily cleaning in our classrooms.
Wow.
I grew up when the schools were mopped every day.
Right.
That is not the case anymore. Teachers have a broom and a dustpan, and they're expected to do that themselves. And then they have some wipes that they bring from home. That's not okay. Also, ensuring that schools are kept at the proper temperature. I have a relative who works at an APS middle school, and she's constantly blowing out circuits, plugging in space heaters, just trying to keep her classroom at 68 degrees. That's not okay for little kids. So I think we've got to look at just some basic things to keep our children healthy, because they get sick, they bring it home, they reduce our immune systems. So yeah, there are so many public health concerns as we gear up for Omicron, which appears to be milder, appears to be more vaccine resistant. Maybe the virus is morphing itself into a common cold. Things point to the fact that coronavirus is going to be like the flu. It's going to go from a pandemic to epidemic, and it's just going to be with us. So we are going to have to learn to live with us. And going back to the hospital, building a hospital is great. How are we going to staff it?
Right.
That's why the ICUs closed the Gila Regional, because they don't have the staff for it. Our nursing programs in New Mexico are waitlisted because we don't have the capacity. So we've seen articles, we're relying on traveling nurses. So where are we going to staff a new hospital?
That's a legit point. Lots to think about there. Dee Dee, I'm sure the folks up there, your old colleagues, would say, look, it's not that hard to do everything. We can do all the above. We don't have to do just one thing, then the next thing, then the next thing. Because there's so much money out there, it almost seems like they're doubling up. You get the National Infrastructure Bill money, and the State Senate voted to spend $500 million on available infrastructure. Is there anything wrong with that? Just kind of taking it all on at once?
Well, I think that when it comes to broadband, for example, I think that, you have to have the capability of putting it into practice. And I think that the IT department came and said, we can't handle all this money. They said that to the Senate Finance Committee. And so there was a cutback there. But it's interesting because this money that is being appropriated will largely be administered by state departments. That, of course, was the subject of the lawsuit between the legislature and the governor.
That's right.
The legislature wanted the power to appropriate this. And okay, now they got the power to appropriate this. And it's going to be actually the governor's secretaries that are figuring out where the rubber meets the road with these funds. Now, fortunately, there's still time, and there's still the bulk of this federal money to appropriate.
That's right.
And that will be done during the regular session. I think there's over $700 million that the legislature still has to appropriate. So that'll happen later.
Laura, real quick, got about just under a minute. Your sense of where Dee Dee just left off and how things are going to look in the legislature going forward. Again, with this kind of money on the table, people make interesting decisions.
Right. I mean, I think we've got this current special session that I'm sure everybody's getting tired of already, given competing, personal need to get the holidays rolling and all of that stuff. But after the break, once they come back for the regular session, I think it's going to be important for folks to really sort of clear their minds of where they've been and think about what makes the most sense going forward.
Right.
So that's a time to really consider the governor's agenda. There's been this unfortunate fight between the legislature and the governor, but the governor's in charge. This is a special session. This is a regular budget session. She's going to have a call. And so they're really going to have an opportunity to think about what makes sense with regard to what's on that agenda and how they're going to make appropriate decisions going forward. So I really hope that people sort of clear their minds and have a chance to connect with family, come back refreshed and ready to really do the people's work starting in January.
Good stuff there. COVID-19 will remain a top issue heading into 2022. Find out where it ranks in our countdown of the top 10 stories of 2021 during our end of year shows as we round out December here on New Mexico in Focus.